Today I have Carmen, who is one of our nurses. She's been with us for a very long time, and Carmen is going to share a little bit about her weight loss and wellness journey and all the things that she did to kind of help optimize her health. So, Carmen, do you want to tell us a little bit about kind of your health prior to coming to YDH Health?
So I was a bedside nurse before I came to YDH Health, and if you've ever met a bedside nurse, we do not eat well. We kind of just eat on the fly and eat on the go. So that's kind of how I picked up my eating habits. I have a really big sweet tooth, and all of that kind of followed me into pregnancy. I had my son in 2021, and then the bad habits that I picked up through pregnancy just kind of followed me after that.
So initially, what would you say was the workup? Was it like, here's a diet, go at it? Like what was the process like for you?
So first, you start with labs, and then we got all of my hormones corrected after pregnancy, and obviously waited until I was done breastfeeding, all of that stuff. But did a whole bunch of labs, and then you kind of, I guess, just tailored a plan that was best for me when it comes to peptides and what peptides I should be on. And then I worked with Stacy, who was our health coach previously, and then Jenny, who's our health coach now, just to keep my macros in check. I would say the hardest part for me was just trying to figure out the workout portion.
Postpartum hormone imbalance is actually really common. A lot of times you'll see in traditional medicine, they'll say, oh, you're just a new mom, just give it time, give it time. While that may be true, you do need some time. You also need to have someone looking at your hormones, looking at your gut health, looking at your thyroid, looking at your nutrient deficiencies, because all those things is what leads into a good comprehensive approach to wellness and weight loss. So, Carmen, what would you say is your biggest non-scale victory? So like not the in-body, not the number on the scale. What would you say your biggest non-scale victory is? And that could be like a certain pair of pants that you wanted to get into, a new dress, like anything like that.
So I would say my biggest non-scale victory would be that my bra and underwear didn't.
She needs new undies, basically.
I didn't know
They're
that
like
I didn't need them.
now.
I didn't know I didn't need them. My husband said, "Oh my God, like your underwear is hanging off of you," and I was like, "What do you mean?" And it was genuinely way too big.
With the
so
cheek slip.
I got to splurge on some new underwear.
So some new undergarments. Okay, so over what course of time and how much weight have you lost?
So probably 2-3 months after I had Brooks, I was at my highest at 215, and I know a lot of that's like baby weight and mom weight, but for me, and I don't lose weight well, I've never really had a good way to do it. I knew that was going to be like my highest and could be higher if I didn't change something. So at my highest I was 215, and then that was in January 2022, and then until now I'm down to 148.
So that's a total of how many pounds?
60
and some change?
60 and some change,
yeah. So that was like a year.
But I don't really care. I always tell people, I don't really care about the scale. Like, I don't care about what the weight looks like. My biggest concern is like body composition. So
right.
I think that's different for every person. A lot of people, I think they care about that weight on the scale a lot, which I think we just have to kind of change our mindset for that.
What would you say was the biggest challenge along that year and couple months journey for you for your weight loss? Is it
just trying to figure out like how to work out. As a new mom, you just have to do what you can. So it would be like trying to do squats with Brooks in the bathroom or the kitchen or wherever it was convenient. But now I finally feel like I've gotten it, and sometimes you just don't even know what to do in the gym. So,
and typically when people struggle with their weight and when they come to us, it's not new. Like most of the time, patients have struggled their whole life with their weight, and they're like, all the normal things that I'm doing are not working. What would be the biggest piece of advice you have for someone who's either considering coming to YDH Health or like hit a weight loss plateau where they're kind of like stop? What would you like if you had a piece of advice to give them? What would it be?
Just don't be so hard on yourself. Like, we can be the biggest critics when we look in the mirror, and truly how we see ourselves in the mirror is not how maybe somebody else sees us. It's true. I would say just don't be so hard on yourself in that aspect, and then come into it with an open mind. Know that some of the things that we do here at YDH Health is not conventional at all. It's not the way that people go about losing weight.
It's not even what other like weight loss centers do.
But the way that we do it, I would say, helps keep the weight off long term, and kind of helps your brain relearn how to eat and how to take care of yourself.
Perfect. Well, so this was Carmen's weight loss journey, and we hope to do more of these testimonials to see like real life stuff. Yes, they work here. Not everyone is like, you know, fit and looks like Stacy and Lauren. But we're here to help you, and Carmen is a perfect testimonial of what a good comprehensive approach over time can look like.